The broadcast is now starting. All attendees are in listen-only mode.
Good morning and happy Valentine's Day, everyone. I'm Nathan Kratz, Communications Manager at Drug-Free Action Alliance, and I'm here with Tony Coder, our Director of Advocacy and Public Policy. He'll be leading this webinar today. If you have any questions, feel free to enter them, and we'll answer them when we get to the end of the webinar. Without any further ado, we're going to go ahead and transfer over to Tony now.
Good morning, everybody. This is Tony Coder reporting here from Drug-Free Action Alliance studios, I will say, here in Columbus, Ohio. Thank you, Nathan, for that kind introduction. And so we'll get started. Lots of things going on at the State House. The legislature is back in session and have started to introduce bills that are, some of them are kind of interesting. The first, the big one I want to talk about is the House Bill 49, which is the biennium budget bill. This is the bill that will guide the budget process for the next 2 years. It has to be passed by and signed by June 30th of this year. So there will be lots of debate, lots of different interest groups and lobbyists that will be going in and out of the State House, including Statewide Prevention Coalition Association, which we will talk about in a little bit, their Legislative Advocacy Day. Basically, what we have been given is that there will be a flat fund, maybe even a little cut in funds in primary prevention dollars. We are operating, the state of Ohio, not we, the state of Ohio is operating at a deficit right now. They have not gotten the tax revenue that they thought they would. So they're having to look at this from a different perspective than they have the last couple of budgets, and that is from a deficit. What are those things that we're going to have to eliminate? What are those things that we're going to have to look at and flat fund? Very few pieces that are going to be have an increase in funding this time, but should be an interesting process. One of the things that we're going to be looking at and trying to advocate for are the 4 priorities in the budget document that we had sent out this November-December time, where we looked at it. We want funding for school-based prevention. We want funding for community-based prevention. We want there to be a focus on folks who are accredited, who do prevention services, who have the OCP, the Ohio Certified Prevention accreditations, and we want to make sure that they're the ones who are leading the cause out in the local communities. We had also asked that there be a prevention coordinator in each county that kind of looks at what's going on in their county or in their community, lifts that up, and kind of has everyone follow, coordinate the prevention efforts in the county. So those are some pieces that we're going to be advocating on. Whether if you want our document, we can surely send that to you. The final document, we've sent it out a couple times through SPCA newsletters and things like that. So if you don't have that, please let us know, and we will make sure that we get that to you. But even if you don't have that document, this is a good time. I mean, with all of the opiate issues that are happening in communities, and now it's the fentanyl seems to be getting a lot of press down here in Columbus, and cocaine seems to be on getting some more traction, I guess, stories than they have in the past. Obviously, marijuana will be we'll have to work with in the coming year. These are things that we need to lift up as far as why prevention is going to be needed in our communities. This is not just about a heroin epidemic or anything else. This is about a substance use disorder and addiction epidemic. So we really want to lift those pieces up anytime that you're talking to your legislator, your decision maker, or even people in your community. The need for good prevention. You don't know how many champions are out there that maybe can make a call or write a letter asking for primary prevention funding. And I go back to primary prevention funding. We have to explain what prevention is. Yesterday I was at a meeting and had to talk with some pretty heavy hitters that needle exchange programs are not prevention, primary prevention. That's more death prevention and HIV prevention, so which are absolutely needed in our communities, but we can't forget about primary prevention and helping folks stay away from ever using the first time. So we really need to hammer that home as well. Also, another bill that's getting a little bit of traction is Senate Bill 1, introduced by Senator Frank LaRose. It's the drug abuse bill. It was introduced last General Assembly, didn't get passed, so it was the first thing out of the gate from the Senate this time. Basically what it is he is putting stricter laws on regarding fentanyl, a lower amount. So if a person possesses fentanyl at a much lower amount than it is now, then that person would face a much harsher penalty, a much harsher basically jail time, which we really do think is something that is neat. I mean, these are folks who are preying upon folks who have a substance use disorder. They may be even telling folks, this is heroin or this is some other kind of drug. They've laced it. I know that they had been using it with other kinds of drugs, marijuana, cocaine, all of that. And we need to make sure that these folks who are preying upon these folks, that they be punished for what they're doing, because this is not, fentanyl is not anything that we need to be fooling with. This is something that we really need to be looking at. I mean, the smallest amount can kill a great number of people. So we really need to make sure that that doesn't happen. So the Senate Bill 1 is an interesting bill, and we actually think that will probably get through the Senate pretty quickly. I don't know what it will do in the House, but it is something that they're considering pretty strongly over in the Senate. Just a bill that actually will probably not go anywhere, but just something to keep on your radar is House Bill 24, the alcoholic ice cream bill. Not only is it a strange title, it's not an ice cream for someone with an alcohol use disorder or anything, but it is something that basically is you can have Klondike bar, not the brand name, but ice cream bars and any kind of ice cream infused with up to 6% alcohol is what these two legislators are doing. I don't think this will pass. This is introduced by a couple of Democrats who are obviously minority in the House. So, but it is something that again, as I've said in the past, might be a conversation starter. Some folks will say this is a good business model, that we need to allow this because of the increased revenue, all of that kind of stuff. We need to keep public health in the forefront on this, and these types of products that are being used in that can be appealing to children, really run a danger. So we're looking at that bill. I don't even know if it will get one hearing, but just want to bring it to your attention that this is out there. We also have a marijuana update that is happening. This is the Medical Marijuana Advisory Committee. So what they have done to update everyone is the rules. They have made some changes to those, some that we like, some that we obviously don't. The pro-pot lobby is extremely strong. There are no less than 5 pot lobbyists that I know of, probably more. They're having a huge cannabis is what they're calling it, seminar later this month in Columbus, Ohio, attracting a lot of lobbyists, including some who actually worked on the No on Issue 3. They worked with us on a No on Issue 3 campaign. They worked on our side. So that's disappointing. The appeal of money seems to be something that is really strong. But basically what they've done is they've increased from 18 to 24 growth sites. With those growth sites, they've also increased. So basically there would be 12 Tier 1 growth sites, which are the larger growth sites, $200,000 to get on, $200,000 fee to start one of those. And then there will be 12 Tier 2s, which are smaller, and only $20,000 for those growth sites. They also increased the size of the Tier 1 sites to 50,000 square feet. That is a large number, or a large amount of land. It will all be indoor, so you won't see pot farms per se, so you won't see a big plot of land or anything, but you will see warehouses where these things are, where the plants are grown and all of those types of products. They also increased dispensaries from 40 to 60, which is still relatively low. That's not even one a county. However, what we will probably see, if it is anything like any of the other states, is that these dispensaries will end up in poor minority neighborhoods. You'll see a great deal of them probably in Cleveland, Columbus, Cincinnati, Dayton, Toledo is where I'm guessing the majority of them will be. There's not anything as far as restricting them to one per ward or anything like that. Is basically there will be 60 licenses given out, and this is where they will be. So even though the thought, I think, among decision makers were that there would be kind of evenly parceled out around the state, the reality will be, if it's anything like other states, in kind of concentrated areas and neighborhoods, and this is where folks will be. They increased this. What they had said was that they, for a dispensary to be able to stay in business, that they will need no less than 300 patients per dispensary. So they're thinking, that's a lot of patients there. My math's not good. I know it's either 180,000 or 1.8 million. I don't know which. I think it's 180,000. So if I had a calculator, I'd do that real quick for you. But so they're talking about 300 patients per dispensary. That's why they increased it to that number. They didn't want it to be more, or they didn't want it to be so overwhelming that wow, it's only 18,000 folks. So that's not a great deal at all. My fear is that they are going to expand dispensaries in the next year or two because the pro-pot lobby will say that's not enough. And that's when we're going to start seeing problems. We did get, due to, quite frankly, the large number of public comments from folks like you out in the field, home delivery was eliminated. In fact, we doubled the number of comments that they had supporting it. So home delivery is not allowed in Ohio, which again is all about your advocacy efforts. It was not about DFAA, not about any other organization. It was about you writing in, taking the time, and making sure that this was not something that was going to be in your neighborhoods. Large cars and trucks driving around with great deals of marijuana delivering them. That's why they left the caregivers in. Caregivers will be allowed to have 2 patients per caregiver, and that should be something that. We also need to watch. They had wanted to increase to 5 caregivers, or 5 patients per caregiver, which again is, they would be able to possess 90-day supply for each patient. So, that's a great deal of marijuana. We think that is our next step. It will be here. The hearing or the next meeting will be February 23rd. We're going to determine what a 90-day supply is. This is going to be, in my opinion, a hell of a fight. Obviously, they will want very, very liberal amounts, liberal quantities, and we will want to limit that. If this is going to be a medicine, a 90-day supply of especially edibles and plant matter, and with no science behind any of this, is really something that is going to be like shooting a dart at a barn wall. I mean, it's going to be needle in the haystack type of thing. So we're going to be doing that. We're also going to be looking at how much the 90-day supply, can you have more if it's a lesser amount, all of that kind of stuff. So we are going to need your public comments after this hearing. We don't have the rules yet. We should be getting those probably Wednesday of next week. And then we'll be discussing them in the Medical Marijuana Advisory Committee meeting, which anyone is invited to. There's a lot of pro-pot folks. How do I know they're pro-pot folks? Because they always wear their ties and pot leaf T-shirts and things like that. So if you ever want to come down, it's somewhat of a boring process, but it is a lot of good conversation. No public comment is allowed to be taken, but you can hear some of the how some of the groups are feeling about things. So that's what we're looking at right now. We'll get more updates as they come. It's something that we really need to be looking at. Also on the marijuana front, as far as nationally, there's a lot of bills that actually state legislators are looking at from the states of Rhode Island, Vermont, New Hampshire, Connecticut, New Mexico, and Maryland. They're all looking at legalization bills. There was actually one just introduced late last night in Minnesota as well. So these are all to legalize recreational marijuana. We think that that we're going to win on all of these states. Rhode Island will be the toughest, quite frankly, and but we have a good road. We got a good ground game there. Be introducing some things in Rhode Island and have a really good group that's working out there, the Rhode Island Prevention Alliance. A lot of folks ask about the federal government. What do I know about marijuana and the federal government? We are getting some, I guess, rumors that they will not mess too much with states that have done it, but they are going to enforce federal law a bit more than they have in the past. Are they going to enforce the Cole memo? Is there going to be a new Cole memo? We don't know, quite frankly. We're hearing, these are all rumors that we're hearing until Jeff Sessions, who was just appointed Attorney General of the United States, gives some kind of statement on this. We just won't know. ONDCP websites and Twitter accounts are still shut down. We don't know who's going to run that organization. Tom Price was just nominated and confirmed for the Health and Human Services group in D.C. He is very, very anti-marijuana. We don't have an administrator for the FDA right now. There's been some kind of scary rumors about a venture capitalist from California who is really pro-marijuana that will be leading that up. And he also would, he's more of a business person, so he would not, he would lessen the time that it would take for a medicine to get from compound to market, which would lessen the amount of tests needed and all of that kind of stuff. And when you're talking about that, you're talking about a pretty dangerous thing that you're messing with. So we're hopeful that he won't get chosen. But again, we just don't know. We know that another Trump nominee, the National Security Advisor, was just actually resigned today because of some issues he had with Russia. But we just don't know what's going to happen at this point, and there's been no kind of inkling on which way they're going to go on this issue. Last week, the Attorney General, Mike DeWine, had issued his recommendations from the study committee that has been going around the state listening to folks on school-based prevention. And some of the things that Attorney General DeWine, he had 15 recommendations. One was that there should be kindergarten through 12th grade substance abuse prevention education. It can't be just something that you get in 5th grade for DARE or whatever else. This has got to be a K through 12 type of curriculum. It also has to be evidence-based or promising practice, those types of things. Some guidelines from ODE are necessary. The study committee said that they believe the choice of a specific curriculum should be left to individual school districts as well. So there would not be a mandated curriculum per se. It would be up to each school district to do that. Again, these are recommendations. There's nothing that will be put in law that any of this has to be followed. But it's recommendations. It really kind of comes from the bill that was passed last General Assembly that made every school district have to have some kind of prevention education or opiate education in the schools. Very, very open bill that didn't give a whole lot of guidance. I know OMAS took the lead on this. Andrea Bucks did a great job in trying to lead up what kind of recommendations they had, and this is kind of a follow-up to that. The second thing that they recommended was that there would be required reporting for schools. That schools in Ohio would be required to report what kind of substance abuse education went on in their schools. These reports should be electronic, available to parents and the public, so parents can see what kind of things their schools are working on, looking at as far as prevention practices. The third piece that they recommended was that there would be social and emotional learning content standards. Ohio's incorporated these standards in grades K through 3. The study committee recommends that Ohio extend these standards through grade 12. So the social and emotional learning content standards would be something that schools, according to the Attorney General, should be looking at and implementing in their classrooms. There should also be more of a focus on school and community surveys to let folks know what the environment is for folks in each community. They don't, we can focus on, whatever, but, everyone seems to be focused on opiates, but if marijuana or alcohol is your #1 problem, that's what should be driving the conversation and not just news media. So the study committee did recommend that schools implement school and community, student and community surveys. We know that there's a couple of surveys. I can't remember the exact acronym. The YSRB, I think it's called, and the OYES survey that the department has put together are both available. So those school surveys they feel are very important. The fifth point that they want to put across is that they want to expand substance abuse curriculum across subjects. So it shouldn't be just taught in a health class, that somehow the curriculum should be infused into other subjects like science, language, arts. Their example is Brain Power from NIDA, examines the scientific effects of drugs on the body, and it's used in science classes. So this is another thing that they said that should be expanded. That there should be resources for schools about substance abuse prevention, and that's kind of self-explanatory. There should also be substance abuse and mental health intervention training for school employees, teachers, and guidance counselors and school personnel, how to detect substance abuse or mental illness in children. The eighth recommendation was that there should be dedicated prevention personnel at the Ohio Department of Education.
Right now, they do focus on all things that are education related, but I know that Janet Jackson does a phenomenal job, leading those efforts for the Department of Education. But if there can be more dedicated personnel at ODE to help out and to be a resource for schools around the state, that was a recommendation that that the group came up with. Continue to involve and strengthen law enforcement's role. A lot of folks use DARE in their schools, and they want to encourage evidence-based. DARE's come up with a new, more evidence-based product than they had in the past, and they also suggested, this study committee suggested that there should be additional ways to partner with local law enforcement on prevention efforts. The 10th recommendation is they support before and after school programs in their communities. 11th, that there be community-based prevention. So coalitions, how can we make sure that community coalitions serve as a resource to their local schools as well? That if, obviously the Department of Education can't serve everyone as far as prevention, that there, we have a number of great community coalitions that are doing great things in their community. Why are we not making sure that they are involved in this process? The 12th piece, 12th recommendation, is that they engage family and caregivers and somehow get prevention messages in schools to be reinforced at home by families and caregivers. The 13th is youth-led prevention. Prevention efforts led by youth are particularly effective in reaching their peers, so peer-to-peer education. The 14th recommendation would be incorporating prevention in higher education, so we don't just stop K through 12, that somehow colleges are involved, something that we know that the Ohio College Initiative here at Drug Free Action Alliance and Cindy Clowner works on every day. They made that recommendation, and that should be strengthened somehow. And then also future work of the study committee. The study committee does not just fade into into the oblivion, that somehow they continue to look at this issue and they provide more recommendations and how to implement these recommendations in schools. So this is basically a kind of a really quick, there is actually a 30-page document that Attorney General Mike DeWine came up with that can be found on his website. If you need that, we can obviously get that for you and send it out to you. And again, that is on the Attorney General's website, right on the front page. It's part of the little flash piece that comes up as you look at that site. Really quickly, I know we have just a couple minutes left. There is a SPCA and Youth-Led Advocacy Day, March 18th. At 9 a.m. they're going to gather. We're encouraging coalitions to make appointments anywhere from 10 to 2, but there'll be a real quick kind of touch base and what we're focusing on, maybe some resources passed out. This will take place at the Ohio State House. Some of the needs that I would encourage you to bring to the Advocacy Day are local community resources. How does your community look? It would be interesting to see if opiates are not your big problem, if alcohol or marijuana, that might be something that that would be really surprising to some legislators in our General Assembly. Obviously, bring things on opiates. That's the big issue that folks are dealing with down in Columbus and across the media, how that is looking in your community. The budget, when you talk about any kind of issues, you can talk about the budget and the need for primary prevention without crossing that line and saying you need to do this in House Bill, in the biennial budget House Bill. You can instead just push that prevention needs to be funded at a level to and talk about maybe the school-based issues that we summaries that we just talked about, or some community coalition funding that needs to happen to strengthen those organizations in our state. Obviously, talk about marijuana, how you feel about that, what you think of. There's going to be a huge piece about creating a tax on marijuana. A lot of legislators are looking at plugging some budget holes. We have to remind these folks that these budget holes are not going to be plugged, in the immediacy, because dispensaries aren't really supposed to be open until probably 2018, so half the budget will be gone, so don't plan on that money now. And secondly, for all of the monies that will be collected, it's going to go back out in some kind of social cost. We see homelessness being up in Colorado. We see 40% of all monies in Colorado being used for treatment, 30% for prevention. You know, the big push for this was that they would build better schools and all of that kind of stuff in Colorado, and many of the principals out there have said they have not gotten $1 for any kind of new buildings or resources. So it's all going back to drug driving and social services, just like you and I all know that it would be. Law enforcement also, if they're going to be asked to enforce these laws in Ohio, they're going to see an increase in the amount of marijuana out there. And then also alcohol. Was at a very interesting meeting how Columbus, Ohio has been chosen by Anheuser-Busch to be one of 6 cities where they're going to be doing a big study group on how to decrease problem drinking by 10% by the year 2020 in these 6 cities. We're the only one in the United States. The others are mostly European countries. So this is something that we are a great test market. That's why we were chosen. The Columbus Health Department Columbus Department of Public Health are doing some things with it, and they had some pretty big plans for that. But alcohol continues to be our #1 problem in society, quite frankly. So some of the other things that they talked about, they want to actually have lower alcohol beer products or no alcohol beer products represent at least 20% of all global beer volume by the end of 2025. They also want to influence social norms by investing $1 billion across 6 markets and have labels on all of their beer products about harmful drinking. So these are some things that Anheuser-Busch are leading up with the city of Columbus. I didn't know if there were any questions or anything that we might have. Nathan, do we have any?
We don't have any questions right now, Tony, but I did want to put forth a question. Let's say that I was a member of a coalition. What recommendations would you have for me to engage my community in advocacy? Some of these proposed rule packages are 20, 30, 40 pages, and it can be a lot to go through.
Well, I think we do one-pagers or 1 or 2 pagers on what some problem rules are, some rules that we need to look at. Continue to pay attention to those. I think we do a pretty good job of giving guidance on what rules are out there. That these next rules about what is a 90-day supply are going to be terrible to go through. And we need every person to kind of chime in, and the lobby is going to say that the 90-day supply are going to be huge. So we're going to need to push back on that, talk about public health, talk about these high-potency edibles and things that we're going to have here in the state of Ohio are not anything to be messed with. This is not your grandpa's weed or your dad's weed or hell, even your older brother's weed. This is marijuana that was quite frankly not even around. It was not, we didn't have such things as marijuana gummy bears until industry started to be set up. So this is not marijuana legalization from a point of your granddaddy's weed. It is all about edibles and pieces like that. So we will continue to create those one-pagers to give to you to kind of summarize everything and break everything down. So I encourage you to look for those in your SPCA newsletters and some of the legislative advocacy updates and those types of things. We'll also have legislative action alerts, so I hope that answers that question.
Well, everyone, that concludes this month's advocacy webinar. As always, we thank you for joining us this month and for your dedication to healthy communities. As a reminder, you will be able to find a recording of this webinar on our YouTube channel, which is Drug Free Action. Again, thanks for joining us and have a great day.